Hello friends, today we are going to discuss here about BCBR assignment 4th and MCQ 1 to 30 we are going to discuss here. Let's start. Which of the following must be considered while measuring occurrence of a disease? The number of people affected by the disease, the population size from which the case of disease arises, the length of the time population is followed, or D, all of the above. So the single best answer here is D, all of the above. Is most useful for evaluating the impact of prevention program, point prevalence, period prevalence, case fatality, incidence. So what is single best answer here? So answer is incidence. Which one of the following statement is true? High cure rate can increase the prevalence of disease. Low case fatality can reduce the prevalence of disease. Both A and B. High cure rate and high case fatality can reduce the prevalence of the disease. So answer here is D. Measure of disease frequency, incidence, prevalence, C is birth rate, or D, A and B. So answer is A and B. A and B, it's D1. Okay, so our answer is D. Now, a measure that reflects severity of an acute infectious disease, case fatality ratio, incidence rate, prevalence, or mortality rate. So the best answer here is case fatality ratio. Now, incidence data can be used to measure the occurrence of disease with gradual onset. True or false? So this statement is false. This measure reflects the impact of disease on population in terms of death, incidence density, case fatality, disease specific mortality, or attack rate. So answer here is disease specific mortality. While measuring the frequency of chronic disease in a community in terms of incidence per 1,000 person per year and point prevalence per 1,000 person, what is the expected pattern of incidence and prevalence? Low prevalence, high incidence, high prevalence, low incidence, both prevalence incidence will be similar, or none of the above statement are true. So the answer here is high prevalence, low incidence. In a study among 3,400 children aged 5 to 10 years, 16 children were diagnosed with autistic disorder. Calculate the prevalence autism per 1,000 children. 4.01, 5.53, 3.35, 4.71. So guys, these calculation you have to do by your own, and I'm going to make separate videos how to do these calculations. So this video is not going to be 4.71 is the answer. Very lengthy. Statistic used to estimate the risk of acquiring a disease, prevalence, incidence, mortality rate, or D. So answer here is incidence. What is appropriate measure when a researcher wishes to know the burden of particular disease in terms of number of deaths it causes in a specified geographical region and population? Incidence density, case fatality, attack rate, disease specific mortality. So what is the single best answer here? So guys, all options in front of you. So best answer is disease specific mortality. If health policymaker want to evaluate the impact of a prevention program, which is appropriate measure to be considered? Period prevalence, incidence, point prevalence, case fatality. So the best answer here is incidence. Okay, answer is incidence. Now Select the correct statement among the following. Prevalence of disease will increase when it has high cure rate. Prevalence of disease will decrease when it has low case fatality ratio. Prevalence of disease will increase when it has low cure rate. Prevalence of disease will increase when it is acute in nature. So the single best answer here is prevalence of disease will increase. Prevalence of disease will increase when it has a low cure rate. When it has a low cure rate. Now, so guys, I hope this video will helpful. What is the appropriate epidemiological measure to determine the severity of acute disease, incidence, prevalence, mortality rate, case fatality ratio? So the best single answer here is case fatality ratio. Now, cumulative incidence is otherwise known as attack rate, case fatality rate, mortality rate, morbidity rate. So the best answer here is attack rate. Cumulative is attack rate. The healthcare professional working in an intensive care unit were asked whether there has been an increase in number of new pneumonia cases. Which of the following factor is inappropriate in calculation of cumulative incidence? Number of new cases of pneumonia during a specific period of time, total number of people at risk of developing the disease in population during the same period of time, or pre-existing case of pneumonia. They are asking inappropriate, or D is both A and B. So answer is C, pre-existing case of pneumonia. Okay. When measure the frequency for an acute infectious disease in a community in terms of incidence per 1000% per year and point prevalence per 1000%, how will the pattern incidence and prevalence be? High prevalence, low incidence. Both prevalence incidence will be similar, low prevalence and high incidence. So the best answer here is low prevalence and high incidence. Okay, low prevalence and high incidence. Now, among 25,000 population in a city, 105 residents were identified with hepatitis B infection. Calculate the prevalence of hepatitis B per 1000 population. So the best answer here is 4.2. At least you have to know how to calculate these values. Which of the following condition tends to increase the prevalence and particular disease? High cure rate, low case fatality ratio, short duration, immigration of patient. So high prevalence of the disease increase. So this indicates what? So all options in front of you, answer is low case fatality ratio. Which of the following true about incidence density? Numerator has number of new cases, also called cumulative incidence. Denominator is number of person at risk. Numerator has person years at risk. So the best answer is numerator has number of new cases. Okay. In a rural block, 1 lakh population, 250 residents were identified with cardiovascular disease. Calculate the prevalence of cardiovascular disease per 1000 population. Answer is 2.5. In separate video, I am going to explain how to calculate these numbers. What is the appropriate epidemiologic measure to determine the burden of disease in terms of number of cases present in a specific geographical area at a specific point in time? Cumulative incidence, point prevalence, incidence rate, case fatality ratio. So the single best answer here is point prevalence. Okay. Now, in a study, 300 children were followed up for a period of 1 year to determine the burden of acute respiratory infection. Calculate the incidence density if the total number of acute respiratory infection episodes recorded was 15,000. So the best single answer here is all options in front of you. If you want, can pause this video, try to answer in comment section. Answer is 5 episodes per children per year. A total 100 people with hypertension were followed up for 3 years to observe for the development of myocardial infarction In a cohort study, at the end of first year, 10 people develop myocardial infarction. At the end of second year, 10 people left with the study, and at the end of year, another 10 people develop myocardial infarction. Calculate the total person years of observation in this study. All options in front of you: 250, 260, 270, 280. You can calculate, and the answer is 270. Okay. During a 1-year follow-up, psychiatrist determined the burden of social ideation among 100 patients with drug addiction. 7 patients has previous history of suicidal ideation and 20 patients develop it for the first time. What is the incidence of suicidal ideation in the study population? 7%, 20%, 21.5%, or 27 per year. So the best single answer here is, you have to answer in comment section, that is 20% per year. Now, this chapter mostly focus on how to calculate these values, etc. Okay, we already discussed this we discuss. Okay, so in this video I discuss 25 MCQ, 5 MCQ left. Maybe in next video I'm going to put. So thank you for watching this video.